At Healthcare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Memorial Day weekend marks the unofficial start of summer, and that means warmer weather. Dr. Pej Bady with Healthcare Partners says how important it is for everyone, especially seniors, to be careful in this heat.
Heat exhaustion is a very common problem that we've had in Nevada and other states for many years. A few years back, there was a high level of temperatures in Chicago, and I think we lost about 40 people, mainly seniors, that were unable to keep themselves cool. And this is an ongoing problem that we have in Nevada and Pahrump. I've been here for 16 years, and time after time, mostly summers, we have at least 15 or 20 admissions that are due to dehydration. We have dehydration admissions in the wintertime as well, but it's obviously more pronounced in the summertime.
And what are the signs of heat exhaustion and heat stroke?
I don't really know the definition between heat stroke or exhaustion. That's a term that we usually don't use as much medically. We just know when a patient is dehydrated or not. We have our own values that we look into, but as a layperson out there, knowing when they're heat exhausted, as you want to call it, or really dehydrated, is there are a few things. Basically, any kind of fluid out of your body that is diminished. So if you feel like your mouth is dry, or if you're urinating once a day or twice a day, or if your heart rate is elevated and you've been in the sun, that's a very common way to tell if you're dehydrated or not.
And how do you recover or treat someone suffering from heat stress?
Well, it's simple. You got to get out of the heat and replenish your fluids. The problem with dehydration is just not the fluids. Your electrolytes in your body are also diminished. So I highly recommend my patients who feel like they're getting dehydrated to increase their fluids. And I like Pedialyte or Gatorade for diabetics, G2, which has low sugar Gatorade, that has a lot of electrolytes and replenish their electrolytes in their body.